Hey, we're going to take a look at something different. Instead of looking at a map, we're going to compare two things for each state. So we'll look at the total number of cases along the bottom and contrast that to the fatality rate. So what that is the total number of uh, deaths divided by the total number of cases. So if a state had 100 people who were diagnosed um, with COVID and there were 5 fatalities, and we would call that a fatality rate of 5%. So we're going to do this for each day, and let's take a quick look at this. So we're starting out first off in mid-March when there are relatively each state has somewhere between 100 to 1,000 cases, and right away we can see that New York in the end of March has 25,000 cases with a fatality rate right now at below 1%, at 218 fatalities. The next closest is New Jersey. And we can see one that did have a fair number was Washington with around 2,500 and a few other cases out there like Louisiana. And the higher they are basically on this bar, then the higher the fatality rate is. So here we can see Vermont has 95 cases, 7 fatalities, which gives them a high fatality rate. However, the data may be a little bit skewed just because we don't have that many cases. So let's continue. Here we see New York just continuing to shoot off, and their fatality rate is beginning to accelerate as well. So now we're in the beginning of April and we see a few things developing. So New York is way out there with 122,000 cases and a fatality rate which has more than tripled to 3.4%. But there are a number of other states out there, like Michigan has 15,000 cases and a fatality rate of 4%. And Washington, I think largely due to the number of nursing homes that COVID was released into, they have a fatality rate of over 4%. So let's keep on playing it through. So now we see we're at about the closing in on the middle of April. And I'm just going to point one other thing out that the highest state out there is Michigan at 6%, which is very high. We contrast that to Texas, which has had relatively few cases in terms of its population at 13,000 and a fatality rate of 2%, so definitely below the average. California also out there, 23,000, but also a fatality rate of somewhere around 3%. So we continue moving along. Now we're in mid-April and we see Michigan just continuing to move up. And New Jersey as well is fairly high. Also, Connecticut, Louisiana, Massachusetts, until we end here with Michigan with 37,000 cases and almost 9% fatality rate, so very high. Connecticut high as well, Louisiana quite high, with New Jersey out there. And we see that about the same as New York, which has 282,000 cases. So nearly, over 3 times what all of China had apparently. And then in California, we have 42,000 cases, about 4%, Florida 30,000, Texas 24,000, and a much lower fatality rate. So this is going to be something which is key in terms of as the number of cases increase, we see in some states that the fatality rate also can increase as a healthcare system becomes overwhelmed. But we also know that sometimes tests are only given when somebody is very, very ill. So, interestingly, if there are not a lot of tests available, then it could be that the only people who are receiving them are those people who are coming into the hospital in extreme need.